Rural placements are so important across the board, not just specifically in mental health, but also there, mainly because they'll have the opportunity to work to their full scope of student practice. And part of the reason for that is that rural and remote clinicians have diverse caseloads, which gives students the opportunity to learn and have many opportunities to practice and apply their knowledge. In addition, I think students, particularly in mental health, get more support from educators and supervisors in a rural and a remote setting, have more opportunities to contribute to decision making and generally feel empowered. And I think most importantly, students learn much more about the social and economic determinants of health. The wonderful thing about working in mental health is it's all about therapeutic relationships, better understanding people and the situations that impact on them. The other thing about mental health is it's a team sport. It's not, no one discipline can actually provide the support that people need. So it's really important to have your allied health and your interprofessional, and the opportunities for that in rural are much greater. Wherever you are, whatever setting you are working in, mental health is relevant. Everybody in a hospital, everybody who's experiencing an injury or a disability has an altered mental state. From my perspective, mental health is not an elective, it is fundamental. It's what you do with everybody all the time. Whether you're in a general hospital or a psychiatric facility, mental health is fundamental to understanding and all the recovery-based principles that go with that, addressing the stigma that surrounds mental health. So the most significant thing about coming on a rural or a remote placement is that it's not just a placement that you'll be doing, it's a cultural immersion. Much more opportunity to be up close and personal with your managers and the health service leaders. So it's not like there's a whole lot of barriers between you and those leading the service. The factors that influence their health outcomes, the social, the economic challenges, the limited access to care, and having the opportunity to walk beside First Nation colleagues, it's tremendous. Really, I think it's quite life-changing for most people who have this experience.